could there be other ingredients in there? Because yeah, a lot of the cold medicines have more than one thing in there. Generally, if there is something like pseudoephedrine in there that's sympathomimetic, a lot of times that will increase heart rate and things along those lines. So it can make the child actually more restless. So again, it can be.
It's interesting, and you know, I'm sure it doesn't happen with all children, but I've seen it happen more than once in 20 years of teaching. That you know, the child comes to school and mom sends a note that says, you know, I gave them a dose of cold medicine this morning, and I mean, you see a totally different child, you know. It's like, wow.
And there was one class of drugs that I actually didn't touch on that I'll use, especially if hyperactivity is a big piece of things. And a lot of times I'll use this in some of the younger children, and those are the alpha agonist medications, which actually originally were manufactured to decrease blood pressure, but have been used in the field of child psychiatry for years as an intervention for ADHD, and really can be very helpful with decreasing hyperactivity. But again, because of the potential effect on blood pressure and that, you have to be pretty cautious with it. But
is this something children outgrow, or do they carry into adulthood?
well, again, that's going to be one of those things where it's variable. A lot of times as children grow and mature, you will see some of the symptoms gradually improve. I think some of that's due to maturity, including neurological maturation. But there certainly are quite a few people where a lot of the symptoms will persist into adulthood. And I think some people are better than others at developing ways to compensate for it, or even to take it and use it to their advantage, and go into a field where actually having ADHD is beneficial for them. Certainly people with ADHD have a tendency to be fairly creative kinds of people, and a lot of times they'll be able to use that to their advantage that way. I've certainly had some of my patients where, depending on what type of work they end up doing, they don't have to take medication, but if they decide to go back to school and take college courses, then they find that they need to resume medication. So again, it can be even variable that way. Well, thanks for having me. I really appreciate it.
Great presentation and a lot of great questions out here tonight. I appreciate that. Now, next month I have another guest speaker coming. His name is Dr. Chris Bojrab, and I think Dr. Shelton knows him and can vouch for his expertise. He's going to speak to us about sleep disorders, and I'm going to probably ask him to speak about all different types of things. So, not just as far as depression and bipolar disorder and other things, but also sleep apnea, restless leg syndrome, some of these things that I think you see these commercials for now, actually, especially restless leg syndrome. There's commercials all over, and you see the little butterflies flying through the air about for medicines for sleep, and so it's in the press a lot. And I thought it might be a timely thing to talk about. So he's agreed to do that, and we'll meet up here the third Tuesday. I don't know what the date is now. I have to look ahead at the calendar, but the third Tuesday of next month. So thank you all for coming. I appreciate it, and hopefully we'll see you here next month.
Great.